Hey everyone, welcome to Darshan Talks. I'm your host, Darshan Kulkarni. It's my mission to help patients trust the products they depend on. I'm an attorney, I'm a pharmacist, and I advise companies with FDA regulated products. So if you have an interest in an FDA regulated company or their products, this is the podcast for you. So today's podcast is what I like to think of as I get a chance to talk to someone who's basically M from the James Bond movies.
Nice.
So if you are in a situation where you go, I'm going to be going to a country that may not want me to be there, and I'm going to solve massive problems, and I don't need guns, but I need vaccines, then this is the conversation you should be listening to. This is the person you should be listening to. I'm talking to someone I've actually known. I don't remember if I actually knew you during your residencies. Probably not. Probably after. But I've known you for about 10 years. He is the director of innovation at Thomas Jefferson University Hospital and in the innovation arm itself. And he's a classically trained pharmacist. He's an emergency room pharmacist. So for those of you who are listening in going, what does an emergency room pharmacist do? This is the guy you should be talking to. Ladies and gentlemen, our guest for today, Rob Pugliese. How are you, Rob?
Good. How you doing? What's up, everybody?
So Rob, let's talk a little bit about what you're up to, what you're doing, because everyone I talk to goes, oh, I have that non-traditional path. And everyone says that, including myself. But you really have a non-traditional path, because how do you go from pharmacy to quote-unquote innovation?
I have done everything possible in my life to be a professional weirdo at every step of the way. That's my goal. If I'm not at the periphery, I'm not happy.
Right? That's the best part. That's the best place to be, at the periphery. So let's talk about what that periphery looks like. That periphery is what you're calling the periphery, other people call innovation.
Right.
And what does the director of innovation do at Thomas Jefferson?
I don't know. Can somebody please let me know? Can somebody please let me know? Be helpful. It really helped me out on a day-to-day basis.
I think Stephen Klasko may have some opinions on what you do.
Yeah, that's where it all comes from.
But he's obviously moving and shaking things. So let's start from that. What is innovation? Because you talk about being a professional weirdo. Is that what innovation is? Thinking outside the box? Are you the artists of the scientific community?
Unfortunately, that's not always the case, right? Like I've spoken to enough folks who are kind of professional innovation people to know that there is no definition of innovation, and one job in an innovation, if we're talking about working for an innovation group at a company, whether in healthcare or not, that can mean 100 different things, right? So like when I talk to people on like kind of typical corporate innovation, a lot of times that's all about mostly finding new business models, right? Finding new products or new places to market their products. And that isn't so much, the total of my job. So my job didn't exist before I got it. And yeah, the name director of innovation design is something that we came up with because the way I got into doing this, I had been, and it's going to trying to keep a straight face while Darshan plays with the screen overlays. The way I got into design was, I was a pharmacist. I was practicing pharmacist in the emergency department for about 10 years, right? I got into pediatric emergency medicine right out of school. I worked at Children's Philadelphia for a few years, met my wife there, then came over to Jefferson, worked in the emergency department there. I've been at Jefferson now for about 10 years. And there's this one thing that anybody who works in healthcare knows all too well is that most, healthcare in America pretty much sucks, right? Working in it, getting it, whatever. I mean, nobody's really happy across the board. And for me, solving clinical problems was enough for a long time, right? Solving the one individual problem for the patient or the provider who, I was working with that day. As a pharmacist, that's what you do. You help not just patients, but providers, kind of get their way through the complexity of healthcare on a day-to-day business. And that's what I did in the emergency department. And it was awesome. It was a weird ass specialty to be in as a pharmacist, and I loved it. But over time, you begin seeing the same problems over and over and over again, and they really beat you down. And I think, there's a lot of talk about burnout and things like that today for people who work in healthcare. And it's because we basically have to deal with the same problems day in and day out, and we have little ability to fix them. So that's what really started pushing me in this direction of, can I find a place where I can help bigger, right? Can I find a way to start chipping away at some of these big, ugly problems that we're all encountering every day? So I was lucky enough to kind of find some co-conspirators, and we started doing some innovation work kind of centered around design. And that's where, for me, that's what innovation is. For me, my innovation work centers around bringing design into healthcare, and the other way around, bringing healthcare into design, and seeing if we can start trying to fix these problems or address them in new ways, or slightly new ways. Because, I think it's not so much always about the new idea. It's about the execution of that idea. So that's kind of been my work since I started it, is, can we do cool things? Can we do things, not just have cool ideas, but can we do things that can move the needle even a little bit? And I did that kind of just on the side for long enough where people started to notice that the work we were doing had an impact on folks. And I was able to kind of make that my full-time job at Jefferson. And it's multifaceted. So it's education. So we're training the physicians of the future in ways that have never been done before. We're training current physicians and healthcare providers and teaching them, about design thinking, and teaching them about product development and startup kind of culture, and how that kind of whole world works. We're working with companies who want to work in healthcare. We're working with people in healthcare who want to start companies and work outside of healthcare. And then, the thing that I really love about my work is the design component, in that we get to, interact with students and professionals, not just in healthcare, but from the engineering world, from the design world. And really, if I were to distill what my job is, what my day-to-day job is as a healthcare innovator in the largest academic health system in Philadelphia, and I think one of the most progressive systems in the country, it is a connector. That's what I do, right? I am, while I guess I do still consider myself to be an expert in emergency medicine pharmacy, my expertise is speaking all these different languages, right? And taking my experience on the front lines of healthcare, my experience being a creative, kind of being somebody who really enjoys being uncomfortable, right?
Mm-hmm.
Kind of living in that ambiguous space, and seeing how I can find people who, if they were together, could do amazing things. And that's a lot of what I do every day, is connecting people and facilitating those connections to allow for, or hopefully to set people down the path of really changing things.
So it's interesting. There's so many different things in there that I want to explore and sort of pull the strings at, if you will. The first thing is, I love how you talked about how you met your wife and then you moved on. It was like you went to that job just to meet your wife. So
basically, yeah, that was it. She stayed. They were like, "We'll take her. Get out of here, you."
Fair enough. You talk about this concept of design thinking, and I've heard that term being thrown around, but what does it actually mean?
That's kind of contentious, right? Design thinking used to be, kind of, I feel like that term has matured a lot because it has become so pervasive in so many different industries. Originally, it was looked at almost kind of like, some of the practices you see in Lean and Six Sigma, those strict kind of methodologies that you follow. And if you follow them, you'll get some kind of improved output. But in fact, design thinking is nothing like that. It really is a way of, not so much a way of thinking, but a way of approaching things. And it's a series of skills that if you practice them, you can just be a little bit better at, let's say, infusing creativity, infusing kind of human-centered methods, being a little more empathetic in the things that you create. So it's less of a process and it's more of so like one of the tools, like one of the most important tools, even though it has this term that a lot of sciencey and businessy people cringe at, that kind of idea of gaining empathy for others, there are really hard tools in there, such as basic things that, most people who practice in the design space, it's just part of everything they do. That's, interviewing others, doing the research into different groups and understanding their perspectives, cataloging them, documenting them, making observations over and over again, and really understanding people and what their needs are. You'd think we do that in healthcare because that is literally what we do, is we try to help people. That is what our industry does. But you'd just be surprised how little or how infrequently we stop and listen to the other people in the room. Right. I mean, we kind of are raised in this ecosystem of expertise, right, where the people who are the most experienced get the most listened to. Right. That's what traditional healthcare is. If you're an attending physician of 30, 40 years, what you say might as well be written in the Bible. Everybody will just do it.
Right.
And that's great when we're talking about, I don't want somebody who just learned surgery yesterday to do my surgery, right? I want that experience. But, there's also a lot of things in healthcare where we need to listen to our patients. We need to listen to the family members. We need to listen to the young people, the old people, the nurses, the janitorial staff, everybody, right? And we need to always be thinking about who is not in the room right now, right? If we're talking about, right, obviously COVID's on the mind of everybody right now. And I've been doing a lot of work in COVID, COVID related health work. And again, like, we got to be thinking about who are we really trying to help, and are their voices a part of this? Because if not, you're probably doing something wrong. And that's, for me, what design thinking is. Design thinking at its core, its best part of it is it really helps you remember, like, you have to be listening. You're not always the expert. There are other parts of it too, like being comfortable with ambiguity, allowing yourself to be creative, not being afraid to show your work before it's finished. Other people call that prototyping, right? That's what a prototype is. Mm-hmm. And one of my favorite design educators likes to say, his name is Alan Chachanov, and he says, never go into a meeting without a prototype. And I love that. Right, because people come with a lot of words and a lot of assumptions, but show me something. That's been a really great tool of mine. So there's a lot of tools in the design thinking kind of toolbox.
Right.
And if you practice them, you generally become a better creative problem solver.
So what you're really saying, and correct me if I'm wrong, but what design thinking is enabling is community or team-based problem solving. But healthcare's always had teams, and we've always suffered from the attending physician's word is God. And if that's true, and you're saying we don't, I mean, I went through a thing where I got my fellowship in interprofessional geriatric care from Jefferson. And as part of that, that was what we were trying to do, which was getting inner professions together to have that conversation. You're sort of saying, let's make that circle bigger. But my question is, and we struggled with it ourselves, why should the attending physician give up the role that he or she has in terms of saying, I know what's best because I'm the quarterback, and why should he or she trust the rest of the team members to follow along, and how do the team members trust each other? Mm-hmm. So how do you get there? How do you address the issue of a chasm of trust that has to be crossed?
I mean, that's a great point. I mean, a lot of it comes down to effort, and of course, nobody I think is suggesting that you bring design thinking into like rounds on the floor.
Well, right? Why not?
Well, that's a good question. Why not? But also, there are places where it fits, and there are places where it feels forced.
Okay.
Right? And I think,
but aren't rounds exactly that though?
They are, right? But you're talking, that's still traditional medical hierarchy.
Sure.
Right? It's still there is a role for expertise there.
Yeah.
What I'm talking about when I talk about the kind of intersection of health and design, I'm talking about more the things that you probably aren't even thinking about. Things like simple things, like how is the waiting room laid out?
Yeah.
Which has become an incredibly challenging thing in the age of COVID, right? Like where the hell do you put people? And then you have places like, like the Institute for the Design Institute for Health, who challenge why the hell do we have waiting rooms in the first place? That's just a sign of bad system design, right? And then you get into, you talk about trying to improve, kind of the social determinants of health in our communities. That's something that healthcare's need to be thinking about more, and kind of moving over to that. And this is something that Dr. Klasko talks a lot about, moving away from the sick care, kind of strategy of healthcare organizations to well care, to, making people stay healthy, not fixing them when they're sick. And that's the kind of stuff that you can only do with a lot of voices, with a lot of voices in the room.
I mean, I'm a huge advocate for the concept of well care. Here's the problem. I don't want to see my doctor often. I don't want you to ask me what I'm up to. I want to see you when I'm sick, and hopefully that's never. And I'll see you in 7 years when I am struggling. That's sort of the general mentality that we have.
And I think you're right. And I think that's exactly why we need to be more creative with what being a healthcare organization means. It's not always seeing your doctor. That's not, and we can't expect that from our doctors, right? Like we can't expect our doctors to be like, hey, do you have transportation to see me twice?
Right.
Right? Do you live next to close enough to a supermarket so that when I suggest that you eat better, that you actually can? Right. I think what needs to change is our understanding or our assumptions of what healthcare is, and take it beyond the go see your doctor, go to a hospital, go to a clinic, and think about it more of, life and what it means to be healthy.
But why is that on healthcare? I mean, I'm a lawyer, and if someone said I can't get to your office, I'd be like, well, I don't know how to help you if you don't get here. Is it now my job to make sure that you have an Uber? I'm not saying it's a bad idea. I'm saying, is that my new role? Why do physicians, or why does healthcare have to go beyond that initial thought process of I provide healthcare, you get here, I provide that?
Right. Well, I think that comes down that now you're talking about, and that comes to the silo, like breaking down the silos, right? Yeah. It's not going to be the hospital, right, who opens up a grocery store.
Right.
But certainly we are 100% seeing the effects of that grocery store not existing.
Absolutely.
Right. Yep. It's costing us money. It's making our patients less healthy. So it's more about how can we think differently about the partnerships we're creating, about what a role in the community is, and all kind of working together more. I know it's not going to be all kumbaya, but we have to think differently about the traditional things, the traditional silos, where our job fixing you when you're broken comes in, and where, I don't know, the city's job making sure that the park next door to you is not filled with, needles and people who don't have homes sleeping in it. So they're intimately connected.
So is that what you see the future of healthcare looking like as part of your role as director of innovation, where you're going, it's not just managing an individual patient's health, but it's really getting into this whole population health, social determinants of health issues, where needles in parks that kids play in expose them to concepts that now I may be dealing with them as a patient because they might become a drug user because they've seen this and normalized this around them. Is that, first of all, is that what you're saying? Maybe I misunderstood you.
I don't. It really doesn't matter what I think it has to. I think that's the direction we have to go.
Okay.
Because if we don't, what will change?
Well, is this the part that needs to change? Is healthcare about improving your health by fixing you with what you came in with, or is it about? And I'm totally playing devil's advocate, but I want to play this out and explore, because people ask that question. Like, one of the things I've wrestled with is people saying that doctors should ask whether you have a gun in your house. Mm-hmm. Is that the role of a doctor? I can totally see a reason for yes, but I can also see someone going, it's my private business. And how do you balance the goals of privacy with the competing goals of population health?
Yeah, right. I'm not getting to that one with you. I'm not about to start debating that one with a lawyer pharmacist.
But we have Lydia who's asking a question. We're moving, it's really a comment. We're moving from a treatment model to a prevention model, which is exactly what we're talking about.
Absolutely.
So let's talk a little bit about innovation in what people traditionally think about. And what people traditionally think about is this idea that we're going to have some version of that Star Trek. What's that flip phone thing they used to have? Tricorder.
Yeah, the tricorder.
Mm-hmm. The closest thing I've heard of to the tricorder is, well, they had I think Musk had a thing where he was trying to get someone to invent the tricorder. He had $1 million prize, the X Prize, I believe. But let's move away from that for a second.
Somebody at one of our emergency medicine physicians from Lankenau Hospital actually won the Tricorder X Prize.
Did they really?
They did. Dr. Basil Harris.
What happened there? Tell us about the Tricorder X Prize.
They're still developing it. They were able to meet all of the requirements for a tricorder. I think they had like 11 diagnoses that they could make with this device. It was pretty damn awesome. And it's still under development, last I heard.
So they could make the diagnoses, but they couldn't prove that they made the diagnoses, is what you're saying.
What do you mean?
Well, if it worked, then, and they won the prize, but they're still in development, that means that they could do something, but they haven't been able to prove that they did it.
Right. It's possible, but that's going to take a while, I think, to develop something like that.
But the other thing you're doing that's really kind of cool right now. Well, I'll get into. There are a few different cool things you talked about, so I'm trying to figure out which one to just jump off from first. But the first one I want to pick on is a line you said a few minutes earlier, where you talked about this idea that you've got healthcare, and that healthcare. Well, you've got design and arts that impact healthcare, but it goes the other way as well. Can you talk a little bit more about how you've seen healthcare impacting everyday design, if you will?
Well, the easiest thing that comes to mind is in education. So, I'm lucky enough to be able to work with students from both of those worlds, right? I work with medical students, I work with pharmacy students, other healthcare students, and I get to work with design students as well. And seeing the type of education that can happen when those two groups are working together and kind of cross-pollinate is really incredible, right? So seeing, not like you said, not just the designer who sees a problem in healthcare and is able to fix it using their design skills, but also seeing what happens when we can infuse kind of some of our understanding of anatomy, pathology, and the scientific method into design. And you're starting to see more and more, let's say, scientific research that focuses on design. I mean, I know, just the concept that PCORI exists. If you're not familiar with PCORI, that's patient-centered outcomes research, right? And that comes through the NIH. And it's basically like the NIH is now funding design research, right? Human healthcare design research with this mechanism. That's freaking amazing. The fact that we are investing in, looking at what happens to humans, not just from a clinical standpoint, right? But what it means for people's lives with these interventions that we're creating. And it's amazing seeing designers who are really actively involved in this high level, this high level research. So, I think the educators seeing the kind of both the designers of the future and the doctors of the future, you'll see a lot more kind of doctor designers and designer doctors, and it's going to be pretty damn amazing seeing what happens when you have a doctor who has been trained in the skills of human-centered design, or when you have a designer who's been trained with some of the skills of understanding pathology, anatomy, healthcare systems, and all of the stuff that we in healthcare kind of take for granted.
So I'm sort of thinking about something you said earlier, which and it just struck me about using design-centered thinking in a in places that you didn't normally think of. And one of the places we spoke about was, well, are rounds necessarily design-centered thinking because you have groups of people coming together. And he said that feels forced. Just out of curiosity, and this is just idle thinking on my part, but you said that that's not the right place for it, and because it feels forced. And I don't fully know what that means in terms of why is it forced necessarily there. But then I took it to the next sort of ultimate step, if you will, which is what happens if you put design-centered thinking um, and apply it to the military.
Oh, the
And
military is all over design thinking.
really,
When I was first learning design thinking, I was lucky enough to attend a program at Stanford, and I was there with two generals, one
huh?
who trained SEALs and God knows where, and another one who trained, kind of spec ops from Air Force from God knows where. So the military recognized the power of this a long time ago, but in their very military fashion, they absorb it and it becomes a part of their culture, right? In different ways. They don't call it. They're not calling it design thinking anymore, but they train their officers. They train their their higher up folks to know how to creative problem solve. I mean, and they've been doing it for a while. It's crazy.
Which is really interesting because to me that seems like the antithesis of a place that would have design-centered thinking because it's so hierarchical.
Yeah, and also too, I now the more I think about that, a concept of I say it's forced on rounds. That's not the right answer. The right answer on rounds is, yes, you could have design thinking, and I think this is where it's not so much that you could have design thinking on rounds, but it's not such you want to like usurp the hierarchical structure there because there's a reason for it. There's a reason why it's there, but can you improve it? Right? Like, I've seen places where designers come on rounds. I can't point you in the direct example of that, but I've seen that. And I've seen that there is some research out there that has looked at what kind of interventions can happen when a designer or, different non-traditional experts can come into that environment and contribute. Also, we know that including family members on rounds, right, really changes the dynamics and how they happen. So no, it's not so much. And I think it's funny because it's like I am constantly battling my healthcare, the upbringing, and try, in because I still, it's not easy, right? It's not easy to get through that, and I think that's kind of a perfect example of where we are in healthcare right now and how hard it is to change things. I literally practice creativity and design innovation every day, and I still find healthcare over like pushing back at it. But no, I think it really is. Sometimes it's not so much the term design thinking, but how can we improve rounds by increasing the voices who are there, how bringing in more talent, bringing in more perspectives in ways that don't necessarily usurp the current ways we do things, but improve upon them. And I think that's an important perspective.
At what point is the team too big?
It's already too big, right?
Okay.
I mean, what's too big? Is it? I think I don't think that's important.
Voices.
I think too big is not the right way to say it. I think what is missing, right? Because you can have 100 people with the same perspective,
Right.
but what voices are missing that could be beneficial? That has to be studied. That has to be kind of explored to know what the answer to that would be.
Okay. So we're getting closer to the timeline. So let me ask you a few questions. One, we have a rapid fire round. Are you down to answer a couple of rapid fire questions?
Yeah.
Okay. What's an accomplishment you're most proud of?
Just because it's front of mind. COVID has sucked, but I've been lucky enough to help out in some really impactful ways. Me and my team are leading vulnerable community COVID testing right now in Philadelphia. We're about to stand up vulnerable community vaccination, kind of again, like infusing this creative placemaking and design thinking into this process to make sure that we're getting to people who other people wouldn't get to. And then last year, I helped 3D print 36,000 COVID test swabs for our organization when traditional supply chains ran out. So this past year has been both, it's been an awful year for a lot of people, but it has completely reinforced kind of why it's important to have people who are creative and to have kind of a design mind in an organization when you have to be flexible and you have to be ready to kind of turn on a dime, and you don't know what's going to be happening tomorrow. It's been crazy. It's been a crazy year.
When are you most inspired?
Like what time of day, or
however you want to interpret this?
I get all my energy comes from others. Like that's why I have to surround myself with a lot of different people. I think that's kind of one of my motivators. So like when I see the faculty that I work with publish or complete a project, it's incredible. When I see my students succeed, like that is where my energy comes from, is seeing others succeed. So I everything I do generally is to help others be better.
What's the best compliment you've ever received?
Oh man, I don't know. I was on a talk earlier today, and the person introducing me said, "This is an amazing guy who can do anything that nobody knows about."
That's a good line.
Yeah,
things that nobody knows about.
I'm like totally cool with that. I think that's actually a really great way to be. I'd love to be that guy who people call, who can fix anything, and I don't need anybody to know about me except for the people who need me. That's fine.
That's really cool. Who's your hero or heroine, and why?
Oh, heroes. I don't know. I don't really have any heroes. There are a lot of people who inspire me, right? Mm-hmm. And especially people, I tend to be inspired by people who are the complete opposite of myself. So, right, because I'm always looking for somebody to reach to. So, people who are incredibly creative, like for example, like animators and people who I'm a big anime fan. People who can tell stories in unique ways, I find just incredibly fascinating. Like, because I'm always looking to figure out how can stories be told, because I feel like stories, again, are something that we're lacking in healthcare. We're lacking, despite the fact that all we do is help people. We need to be able to tell stories so that, people actually do things to be better. If you tell, like, it's like the great example of that is like, telling people to eat healthy. People just look at you funny. There's a way you can tell, you can educate people, get people to eat healthier by infusing creativity and storytelling into that.
Yeah. How do you define success?
Oh man, I don't know. That's a tough one. Every time I've been lucky in my life in that I've been able to meet my definitions for success more than once. And every time I hit it, I forgot it was ever something I was striving for, because I've already got 10 things in front of me. So, I don't know. I mean, I'm happy these days. I'm happy I can wake up every day.
What challenges you?
So much. so much challenges me. And again, I think I'm lucky. I feel very privileged to be able to still have challenge in my life, yet live comfortably. This is something I see a lot in my work, are people who have nothing but challenges that they deal with every day, but have no ability to escape them. Yeah. So my challenges every day are making sure that I remain challenged. And the second I get comfortable, I start getting uncomfortable.
If you won $1 million, what would you buy?
I can't do anything with $1 million.
You're like, the cheapest yacht I want to buy is $32 million.
Seriously, I don't know. I'd fund a fellowship or something so that our lab can work a little bit better. I don't know. That's something that could help somebody else be productive.
Last question. If you were going to build a Mount Rushmore to 2020, who would be the first person on it, and why?
For 2020?
Yeah.
I don't know. Every scientist in the world I would just have one giant female. I'd have one giant black female scientist, because I think that right there is like, that's what we need people to see.
Okay. Very, very cool. We've asked you a bunch of questions. You get to ask a question back to the audience. What's one answer you'd want back from them?
Do you know what innovation is? And if you know, can you tell me?
Fair enough. So during this podcast, Rob, we talked about what is innovation. We talked about the value of trust in innovation, especially around design thinking. We talked about the job of a director of innovation design and how you're still trying to figure that out. And we talked about how innovation goes both ways, how designers help in healthcare innovation. Healthcare innovation helps designers.
Yeah.
So
actually, the real question I'd like to hear is if you could change healthcare, not healthcare now, but like healthcare like 20, 30 years from now, what would it look like?
Fair enough.
That's what I'd like to know, because that's what we need to be thinking about right now. Not like what's healthcare tomorrow, or what's healthcare after the next cool device comes out, or whatever, the next advancement. I want to know, like, really, like 30 years from now, what do you want it to be?
Love it. So nothing in this podcast should be construed as legal or clinical advice of any kind. It's intended for education and entertainment purposes only. For those of you who missed it, Rob, where can they reach you?
So you can reach me. I'm on Twitter at RS Pugliese. You can check out our work at Jefferson Innovation just by Googling Jefferson Innovation, or by the Health Design Lab by going to healthdesignlab.com.
And if you like this podcast, please leave a comment. Please subscribe. You can find me at Darshan Talks on Twitter, or just go to our website at darshantalks.com. Thanks again, Rob.
This guy. Thanks, Darshan.